Together, we are delivering a clear message to business locally, nationally, and across the globe that Jacksonville is open for business. You see that demonstrated in ViStar's decision to locate its corporate headquarters downtown, bringing 1,000 jobs to our urban core. You see it with the decision by fintech leader FIS to build a new corporate headquarters and parking garage in Brooklyn, adding 500 new jobs to the Jacksonville workforce. And we see it with the new container terminal going up at Jacksport, preparing for arrival of new, bigger ships in the years ahead. Our city's strengths evident in our strategic location, skilled workforce, business-friendly environment, and prominence in key industries such as advanced manufacturing, medical care, financial technology, and logistics make us a true international city with a global appeal for businesses and opportunity. One major contributor to our city's growth and reputation is Florida Blue. And I today have the honor to introduce a leader who has played a major role in the success of our city. I'm pleased to introduce Pat Garrity, the president and CEO of GuideWell Mutual Holding Corporation and Florida Blue. Pat was instrumental in strategic restructuring that transformed the organization from a 75-year-old health insurance company to what it is today, a health solutions organization at the forefront of reimagining the future of healthcare in America. Prior to joining GuideWell and Florida Blue in 2011, Pat served as president and CEO at Blue Cross Blue Shield of Minnesota, and prior to that was at Horizon Blue Cross Blue Shield of New Jersey. He's widely considered a leading expert on state and federal healthcare policy matters, particularly in healthcare reform and innovation, next generation payment strategies, and the benefits of wellness and prevention programming. Pat holds an undergraduate degree from Colgate University and a doctorate from Florida Southern College. He's completed education programs at Harvard University School of Public Health and the Wharton School at the University of Pennsylvania. Additionally, last week, I was in the historic Durkeeville neighborhood to cut the ribbon for a new teen center, Club 904, which Pat led the campaign for. This is just one demonstration of his commitment to our community and its future. We're fortunate to have such a community-minded leader in our city. So without further ado, please welcome Pat Geraghty.
Well, thank you, Mr. Mayor. I very much appreciate those very kind comments, and I appreciate your leadership. I appreciate that you have encouraged people to wear masks and done that with, when that is a key part of keeping our economy moving in this town. I also appreciate the partnership on keeping FIS in town, and I think that worked out beautifully. So thank you very much for your comments. Let me just speak to a few things before Aundra and I do a fireside chat. I wanted to comment on these unusual times we find ourselves in. Everyone is probably tired of the term unprecedented times, but when I think about the unprecedented nature of these times, I'm looking at the fact that we have a pandemic, obviously COVID-19. We have the economic fallout that comes from COVID-19. We also have the social injustice and the fact that we have a racial disparity in our country in the healthcare space that really speaks to health equity, and that is a significant issue. And then if any of us had any doubts that there is a climate change afoot, we have 4 states that are burning, and we're on Storm V so far in the hurricane season. So there's a lot going on, a lot of things for people to manage. All of those things have impact on people's health, their mental health, their well-being. And so these create certainly a very challenging time. I'm going to spend most of my time commenting on the pandemic and then a bit on the social justice issue. Here at Florida Blue, we knew job one for us was to get our employees in a safe environment. We had the ability to have people work remotely. Our IT team did a spectacular job. And today we have almost everyone in our company continuing to work from home, and we haven't missed a beat. And so I'm very proud of that team, very proud of what they did. And it has allowed us to serve and take care of our customers. And that really was job one. Keep people safe, so we could continue to do the job that we do for our customers. The next was to say, what can we do differently? How do we reimagine what we do in this pandemic time? And so the first thing we said was all testing that was testing for somebody with symptoms would be covered by us, meaning the member doesn't have an expense, and that their care for COVID-19 would also happen without an expense to the member. And so those were important statements about our commitment. We didn't want barriers to people being tested and people having care for COVID-19. So we made those statements loud and clear. We also said that virtual healthcare was going to be critical. And we then waived the copay for people who were having visits with their physician remotely. And so we took the barriers again away from having care delivered in a remote setting. Altogether, when we look at the things we've done for our members and our physicians, it totals up to more than $200 million that we have unilaterally said we're going to step forward and give these things to customers. So small group accounts had their rates cut. Individual customers had additional incentives that they could earn towards paying their premium. And then we looked at mental health, and we said mental health needs to have the copays taken away as well. So in all of those situations, we were paying the copays. We were paying often the co-insurance. And so we really reduced the expense to customers and to members across the board. Why do we do these things? First of all, it was the right thing to do. Second of all, a lot of care was being deferred. As you know, facilities were making themselves available for COVID-19, and a lot of people were deferring care. We did not think it was an appropriate thing for us to take the windfall from people not getting their health care. So we looked for ways that we could return that back to our customers because we are a mission-based company, and we thought that's the right thing for us to be doing. So a lot of things happening on the COVID space. I know Aundra's got some questions in that area, so I won't touch on everything that we're doing there, but we'll catch some of that in the Q&A. I also wanted to talk about the social justice issues. And this is a area where Florida Blue has taken a leadership. About 3 years ago, we began a series of critical conversations in our organization. Those critical conversations touched on many sensitive things, including race, that many employers don't touch in their workplace. We thought it was important to start those dialogues. So when everything happened earlier this year, we already had some credibility and forums for dialoguing with the people who work here. You know, I happen to come at this from maybe a different angle than some. I'm a fiscal conservative, but a social progressive. And so it's very important to me that we're doing the right thing by our people and right thing by our community, and we're serving people as best that we possibly can. And I also always want to do that in a fiscally appropriate manner. And so as we looked at these discussions, we started 2 dialogues in our organization called Living While Black. And we had employees and then those from outside our organization come and tell their story to our employees, and our employees telling each other about their journey. These were painful discussions. These were discussions that were very needed. And these discussions opened up a sense of community in our organization. Everyone here is learning. Everyone's learning how to get along and how to deal with things that have been unspoken for a long time. Our organization's made many, many strides along being a more open and a more inclusive organization. In fact, our board of directors and our leadership team were acknowledged by the National Association of Corporate Directors as the lead diversity and inclusion organization in the United States just last year. But we have more to do. And it's a dialogue that we want to have with everyone, because if we bring everyone along, our community is better and we are better as businesses. So it's something we can do collectively to make sure we're doing the right thing and to make sure that everyone has an opportunity for access and has an opportunity to do better collectively. So those are all critical issues to us. It's also critical to me that we work as a community, that we do have our businesses moving and working, and our economy is on. And there really is a basic way to do that. Wear a mask. Put your mask on, wash your hands, be socially distant, do not come together in big crowds, and we can have a thriving economy if we do those basic things. There are other things that are happening related to vaccines and other things, but if we do the basics right, if we're committed as a community to do those basics right, we will have many more of our businesses thriving and many more of our businesses open. But we have to be willing to do something for people beyond ourselves. If we look at this as a patriotic obligation, one where I'm wearing my mask to protect you and you're wearing your mask to protect me, we will all do better in that setting. So there's lots of other things I want to touch on, but I thought I'd give more time for the fireside chat and more time for your questions to come forward. So I'm going to hand that back to Aundra, and we'll begin the dialogue. Thank you.
Thank you, Pat. Thank you for your opening remarks with regards to the healthcare crisis as well as social justice. Pat, you've led a group that made recommendations to Governor DeSantis surrounding COVID-19 testing. How has the work of that group impacted Florida's COVID-19 response?
Yeah, so I'll say that the group broadly represented the entire state. We had people like Publix and Disney and FP&L and others that were on the group. We also had very key hospital organizations that represented their communities. We couldn't have everybody, but from here we had the Mayo Clinic and we had UF represented with Leon Haley there. So we had representation from all across the state. When we started, our state was doing 15,000 tests a day. We are not wholly responsible for this, but we contributed to the fact that our state got up to 140,000 tests a day. And we were very instrumental in bringing players together to drive testing volume, to look at sites that would be useful for access to more testing. And then we had things like the University of Florida was actually on the front line of thinking about how to do pooled testing, meaning you could test, if you were going to test a large group of people where likely most of them were not infected, you could actually pool the sample. And if you pulled the sample, you could have 5 samples together, and if everyone was clear, it really reduced the cost of testing. And so we were trying to do things that were innovative. UF's project ended up being reviewed by the White House and blessed, and others are using that approach. So we were trying to spawn creative thinking, bring all the talents of people across the state together, and do the best we could to make sure that we were testing effectively, and really trying to take care of Florida and trying to make Florida a safe place.
Pat, some national for-profit health insurers are reporting record earnings due to many individuals deferring elective procedures. How is Florida Blue's model different?
Yeah, our model is very different. So as you know, we're not a for-profit company. For-profit works in lots of places. I happen to believe, and I've spent my life and career in this, that mission-based companies in the health sector are the right way to go, because we don't want to be playing around with our health. And you know, I think that a lot of these companies declared these huge profits. Instead, we gave $200 million back to our customers and protected our providers, because we said to customers in the individual market that we were going to give them credit. We were going to extend them before we came in and said that we would have to have payment. And so as we were extending people, by the ACA law, that liability actually falls to the providers. But we couldn't extend people and then ask the providers to make that payment. So $50 million of those kinds of payments, we stepped up to ourselves. So we thought that it was the right thing to do, to be living our mission, making payments that if you were publicly traded, you wouldn't likely be making. We made those kinds of payments across the board to take care of our members, to make sure that we were doing the best possible job in our state. And I think that makes us very different than people that are thinking differently about the bottom line as it occurs to them in healthcare. The other thing about our organization is that we're deeply local. We're hyper local. In fact, we have market presidents in 4 different locations across the state. We have our resources deeply embedded in the community. And so when we looked at community giving, we knew that because of COVID, people like United Way were not going to get the dollars they normally get. So our company said, we're going to match $2 for every $1 an employee contributes. So we had the largest United Way campaign we've ever had. And that was intentional. We knew the needs were going to be great. And we wanted to make sure as a corporate citizen, we were doing the things we could do and should do to take care of our community.
So Pat, innovation cuts across every industry today. So what role is innovation playing in our local response to COVID-19 from your perspective?
Yeah, it's a very big factor. You know, I talked all about the telehealth and the ability to get remote visits. When we started the pandemic, 2 million of our 5 million customers in Florida could access telehealth. We very, very quickly made it available to every one of our 5 million customers in Florida. So scaling up to allow telehealth to happen quickly. To telemental health, we scaled that up very quickly. Those are important components. We're also part of a coalition that put up $5 million for an X Prize to develop a low-cost, highly effective test for screening for COVID-19. And we're very, very hopeful that we're going to see a result that will bring the cost of testing down dramatically. As everyone in your audience knows, that if you've got someone who's symptomatic, the test is covered by a health insurer. But if you're just trying to open your business and you want to test people, or you're going to test people on a routine basis, that's an employer's expense. So we're trying to drive that expense down. We don't believe that it needs to be over $100. We believe it can be done for a few dollars. And our X Prize initiative is really trying to address that, because COVID-19 is going to be with us for a while, and we need to take the testing costs down. So we're committed to that as well. We've got an innovation center, and we've got all kinds of competitions going on right now. One with university-based students, looking at how they can innovate to help us drive for lower cost services in the health sector. We've got another one that's looking at the inequities in healthcare and trying to bring the community together to help us solve for that problem. Our strategy is not to say to the communities we serve, hey, we've got the answer and here it is, just join us. We're going to those communities and saying, help us bring the solution together, and then we'll help fund and drive the execution of that strategy that we collectively have decided is the right one to bring to the market.
So Pat, you've recently led a statewide effort of 135 leaders urging people to wear masks and to take other preventive measures to stop the spread of COVID-19. Why did you feel this was a necessary step, and do you feel this effort was a success?
Well, you know, success is in the eye of the beholder. I think we got more work to do. I'm never satisfied. The people who work with me know that, you know, yesterday's success means the bar is higher for tomorrow. So we're always trying to strive for more and to do better. I think Floridians can do better. We've made some progress in this space, but we can all do better. We have to wear masks consistently. What we know about this is it's an airborne disease. It's transmitted from speaking, from talking, from yelling. It's transmitted through the air. If we want our businesses to be open, both people in an exchange wearing a mask allows the business to be open. It really is that simple. If we want to say, I have a right to not wear a mask, then we put everybody else at risk. And so I know this is a controversial issue for some, but this issue from a health perspective is really clear cut. And you don't see health leaders talking about not wearing masks. You see health leaders talking about you gotta wear a mask. It's a fairly simple solution, and it will allow for us to turn on our economies and live the way we want to live.
So what advice can you offer folks who may be putting off visiting the doctor or receiving critical care because of the fear of contracting the coronavirus?
Yeah, I would tell them to that it's really important for them to get their care. If they have concerns, they ought to be calling their health providers and talk about what precautions those providers have taken. I can tell you that the leaders that are on this call from the health sector have made huge strides at keeping their organizations sanitized, making sure people know about that, really isolating their cases of COVID-19 that come into their institutions. And so making sure that they have that taken care of, having your consult done remotely initially, and then accessing care. There are way too many people that are putting off care. I see this from both my perch here at Florida Blue, but I also see it, I'm on the national board of the American Cancer Society. And we know, there's a report that came out recently that probably 10,000 more people are going to die in the next year from delayed detection of their cancer. And so, you know, if you're that afraid of COVID-19 that you don't get your detection around cancer, you're actually picking a different path, but you're not helping yourself. So we've got to get people to get more comfortable that they take the precaution, that wear your mask, keep yourself safe, come in and make sure you're still getting those preventive services, because they're critical to the function of the healthcare system, and they're critical to the well-being of the people we serve.
Pat, I've got one last question for you. So Florida relies really heavily upon tourism. What must be done to jumpstart our economy and be prepared to welcome visitors back to the state?
Yeah, so Aundra, I was just on a call with the folks down in South Florida on this very same topic a short while ago. The short answer to the question is trust, and people must trust, right? We have to be very clear that if people want to travel, they want to trust that where they're going is taking the necessary steps to keep them safe. They want to know that the people where they're going have taken the virus seriously in their community. You're not going to vacation in a place where there's an outbreak. You're going to vacation in a place that has taken the virus down so that the numbers in that community are lower. You're going to vacation in a place that takes mask wearing seriously, and the social distancing. If you follow those basic rules, most of us, there are some people who are willing to take all kinds of risks, but most of us will take risk if they feel like it's a calculated risk, and that the place they're going takes this seriously and has taken the provisions to make sure it's as safe as it possibly can be. Because all of us want to travel, we want to go to restaurants, we want to live our life. There's a whole mental health impact of not being able to do that. And we're all desiring of life to go back to normal. And the easiest way for it to go back to normal is for compliance around wearing of a mask.
So if the audience could, if you've got questions, please submit them. But Pat, politics aside, there's a conversation about universal health care insurance. If that came about, how would Florida Blue fit into that scenario?
Yeah, I appreciate the question, because a lot of times the general public thinks that there's a choice, a private healthcare system and one that's universal care. Universal care means everyone's covered. That doesn't mean who's doing it. It doesn't mean the government does it. It means everyone's covered. I stand for universal coverage, always have. Believe everyone in our state ought to be covered. Many people in this audience know that I've advocated for the expansion of coverage in our state. And I believe to this day that fiscal conservatives would agree that we ought to cover people. And the reason I say that is, if you don't cover someone for health care, they go to the emergency room in an acute state and therefore cost the rest of the system tremendously. So what does a hospital do when they have to take care of somebody who's severely ill and they have no coverage? They push that cost to the employers that are in this audience. You are paying for it because we're not keeping people healthy in the first place. We all benefit from everyone being covered. It's the right fiscal equation, number one. Number two, Washington said to us, we'd pay the 100% of the expansion expense for the first 3 years and then 90% going forward. That's a good equation for Florida. Today, our money, our tax dollars go to Washington. We didn't expand, and the 36 states that did expand are using our money to pay for their expansion. It's not good economics. If we want to care on an economic basis alone, we'd take our tax money back and then take care of our citizens. If we did, the hospitals would have a different equation because people wouldn't be walking in their door without coverage. They could pass that along, and the cost of healthcare would come down for everyone else because you're not getting the shift. It is something that I feel very passionately about, that we ought to cover everybody because healthcare is different than other services. And at the base of my conviction is that it's the right thing to do. Every one of us wants to be covered for healthcare. There's not one of us who would want our family uncovered. And so we ought to just do that as a nation and figure out how to do it most fiscally appropriate way.
Pat, the pandemic has brought about a number of different challenges, but how has the pandemic exposed the cracks in the national insurance and healthcare industry itself?
Yeah, so one of the things that was interesting about the pandemic, from if you were just stepping back and looking at it as a case study, because believe me, there's tremendous amount of human suffering and other things that are involved here, and I don't want to overlook those. But if we're just looking at it as what did it do to the industry and what are the opportunities that it showed us that there were some real gaps in employer-based coverage, right? And so what we found is that our Affordable Care Act plan expanded significantly because people were looking for individual coverage because they lost their employer coverage, and it turned out to be the safety net. Our situation in Florida would be much worse if we didn't have the ACA there to catch people who went uncovered. So whether you like the ACA, didn't like the ACA, I would say this to you. We as a nation have spent billions of dollars, maybe almost trillions of dollars, putting the ACA in place. It's been in place, passed as a law 10 years ago, and now our job is to improve that law, make it better, because it's in place. Ripping it apart will cause all kinds of violence to the system. Many, many people lose coverage, lots of dislocation, lots of providers, hospitals would suffer dramatically in the reimbursement area. So how do we make it better? We have one really big proposal, and that is give a better subsidy to young people to join the pool. When it was set up with a real bias towards older people. And younger people, they think they're invincible anyway, have stayed out of the pool. If we incent young people into the pool, everybody's price gets better. So the federal government could help significantly on that front, and we would have better pricing for everybody in that product if that happened.
Pat, keeping along the themes that the pandemic has really caused challenges. So let's talk about it from a real estate standpoint. Florida Blue owns a large footprint of real estate and office buildings. How will that change because of this pandemic? How will you deal with office space? Because we normally look at it per individual, at least 150 square feet per person. What are you all looking at now?
Yeah, so we're looking at creative ways to think about the spaces that we have. And, you know, when you have a large campus like we have here in the Deerwood area, that's a big undertaking, especially when you own it. So we have to think about how much will this space be populated when we go back to whatever normal is, right? Mm-hmm. I happen to be of the opinion that we're not going to be remaining completely remote, and we're not going back to where we were just prior to this pandemic. I think we're going to find a spot in the middle. I think there will be people who work a couple of days a week in the office and a couple of days a week from home. I think there will be more people that work from home on a permanent basis. And so we're going to be in a much more of a hybrid environment than we've ever been in before. That's going to create opportunities. So we need to think creatively about what do we do with our locations? Do we have too much space? Do we want to share space? We got to think very creatively about what's the right balance for us as an employer. And I think everybody's going through that same equation, trying to understand what the workplace of the future is about. You know, many organizations went through the process of creating collaborative space and huddle space and low walls. And now everyone's thinking, gee, I need to have bigger dividers and more spacing and be sure that you know, people are more safe inside in those settings. And so reconfiguring some of your inside space becomes one of the things that you consider. All of those things are on the drawing board for us. We haven't come to a full conclusion because I'm not sure anybody knows exactly how it settles out, but I know it's going to settle out someplace probably more toward the middle of about half of our workforce being remote and half of our workforce being in office on any given day.
Pat, is that decision really driven by your concerns about safety issues associated with returning to the workplace? Is it driven around lack of vaccination at the present time? You know, because you're one of the larger employers in the region, and I've heard that you all may not be back in the office until, you know, first quarter of 2021. So those are the real major concerns for you?
Yeah, so first of all, I will say true. We are going to remain in this remote setting through the balance of the calendar year. As we get into the fall, we'll make another decision about what that timing looks like. What drove us was a couple of things. One, there wasn't a clear therapeutic drug that could solve the problem should somebody get COVID-19. And two, there wasn't a clear vaccination or vaccination timeline. I speak to people both at the federal level and globally. I'm part of the World Economic Forum, the health ambassadors there, and I was just on a call this morning, and we talk about what the time schedule looks like. I think a reasonable time schedule would be that we'd have a vaccine by somewhere around the end of the year, identified, but from identified to distributed is a long pathway. I mean, I think we're talking about, you know, anywhere on the order of 6 months to a year to get it distributed. So what the pecking order will be for distribution will be critical. We'll have to understand what that looks like. So number one, we always err on the side of the safety of our folks. So if you didn't have a therapeutic identified and you didn't have a vaccine, we were keeping people home. As we return to the workplace, assuming we have an identified either therapeutic or vaccine, we'll then be looking at, does somebody have a compromised immune system, or someone in their family have a compromised immune system? Those folks will have the opportunity to opt to work home. I am not going to force somebody into the workplace who would be at risk for themselves or an immediate family member being at risk of dying of COVID-19. So we got to be very careful about that, and that's a critical part of our timeline and thinking about what our timeline is going forward. So safety of our people come absolutely first in our considerations. We will watch very, very closely the progress on the vaccines, the progress on the therapeutics, and make sure that we're making a fully formed, science-based decision about our timelines.
Great. Pat, I want to thank you for participating in this fireside chat this afternoon. And I want to thank you for your leadership in the Northeast Florida region, the entire state, and really thank you for your leadership on social justice equally as well. You are definitely a gem for this community and an invaluable asset for us. So I really appreciate all the work that you've done. And in concluding this, I know the mayor spoke about capitalized JAX. Everyone that's on this webinar will receive an electronic copy of capitalized JAX. Well, Pat, I know you've got a time-sensitive 1 o'clock call coming up. Thank you for your time today. Brad, I'm going to turn this back over to you, and thank you.
Thank you, Aundra.
Appreciate it.
Yeah, Andre, I concur. What a great session with Pat. Great questions, and just really appreciate his vision and leadership in our community. And so what a time well spent this afternoon. But once again, I would like to thank today's sponsors, Florida Blue, FPL, and ViStar Credit Union. And I thank everyone so much for joining us today and for your continued investment and support in the JAXUSA partnership. And with that, we are adjourned. Thank you.